Welcome everybody. My name is Dr. Umar Shakur. I'm a cardiologist at Insight Chicago, and I'm here to talk to you today about Atrial Fibrillation Awareness Month. September is National AFib Awareness, and we'd like to highlight and give everyone a brief overview about atrial fibrillation and highlight the importance for both detecting this problem and treating it. So I'd like to start at the beginning. Atrial fibrillation is an arrhythmia. It's an abnormal heart rhythm, and it can cause stroke. So obviously something that we want to try and prevent. Atrial fibrillation affects about anywhere from 3 to 6 million Americans. So it's a very common arrhythmia, and it gets more common as we get older. So it's something that we need to pay attention to with time. And one of the things that I think is really interesting about atrial fibrillation is that it's associated with a lot of common conditions such as high blood pressure, diabetes, and so managing these conditions can often help. And in fact, I often tell my patients that if AFib is detected, that usually a lot of the treatment centers around lifestyle changes. And so that means, as I mentioned, controlling blood pressure better, controlling diabetes better. If a person is overweight or obese, weight loss is an important part of the treatment. And also if they have sleep apnea, or we suspect sleep apnea, diagnosing and treating that can be quite helpful, and restricting alcohol intake. So we also check for less common causes of atrial fibrillation. Sometimes your thyroid function can be running too fast, and so that's usually part of the workup as well. But at its essence, what is an arrhythmia? Well, an arrhythmia is basically an abnormal heart rhythm. So normally the heart beat starts in the right atrium, the right top chamber of your heart, and the signal travels down, and it kind of goes, basically you could think of them as electrical wires for your heart, and it allows the top chambers to squeeze first, and then there's a brief pause, and then the signal travels to the bottom chambers and they squeeze second. In atrial fibrillation, what happens is all of a sudden, the signal usually comes from the left atrium instead of from the right, and you have multiple signals that are all firing. And basically the heart rate goes very fast because you have these irregular, rapid signals that are originating from the left atrium, and all of a sudden the bottom chambers of the heart are going very rapidly, trying to keep up with the top chambers. As a result, you end up with an irregular rhythm, and many times it can be very rapid. So this causes two problems. One, if the heart rate is going very fast all the time, atrial fibrillation can lead to heart failure because your heart is basically working overtime all the time. And the second thing is, if you think about it, the top chambers of the heart, normally they squeeze at about maybe 60 beats a minute, 70 beats a minute. So they get a good squeeze, and then the blood is squeezed down into the bottom chambers. If you go into AFib, it's like all of a sudden the top chambers, they're squeezing so fast, it's like nothing's happening, okay? So that's where the term fibrillation comes from. It's like such a rapid squeeze, it's like no effective squeeze actually takes place. And so when those top chambers are fibrillating, what happens is the blood in the top chambers doesn't get a good squeeze, and blood clots can form. And in particular, you can get blood clots that form in a part of the left atrium that's called the left atrial appendage. And randomly, those clots can fall into the bottom chambers of the heart, get squeezed out, and cause a stroke. Those are the two things that we're trying to prevent with atrial fibrillation. We want to prevent stroke, and we want to prevent heart failure. And so usually we use medications if we can to try and restore rhythm and maintain rhythm, and we use medications to try and prevent stroke. Throughout this month of AFib awareness, we're going to have a series of talks that look at the various treatments and tests that we do to diagnose, manage, and ultimately treat atrial fibrillation. So we're looking forward to sharing more education about atrial fibrillation with you. This hopefully will serve as kind of just a good overview of the condition, and in future videos we hope to get into more specifics about how to manage AFib.